We know that while it's true for every cancer, the bone marrow microenvironment is particularly relevant for multiple myeloma development and response or resistance to treatment, and therefore evasion to treatment. This is true since the very beginning of multiple myeloma treatments, but it is even more true nowadays, where many, if not most, of the treatments which are proposed for the later lines are based on immunotherapies, which means therapies that would engage the immune system to fight multiple myeloma and provide a new remission for the patient. So, of course, an immunotherapy, I would say, requires or works better if the immune microenvironment is working in the myeloma patients. And we know that the disease itself, so the clonal plasma cells, will shape the microenvironment to their favor, meaning that the bone marrow microenvironment of a patient with multiple myeloma, as compared to patients with precursor conditions, so asymptomatic myeloma or MGUS, is different, and specifically there are more effector cells, more inflammatory cells, more exhausted cells, as well as more regulatory cells. So those regulatory cells are cells that may blunt the immune response against the tumor, and having too many effector cells will eventually make this response against the tumor less effective, because these cells will become exhausted and stop working, basically. So these so far are perceived as major factors contributing to resistance, which can be primary or secondary resistance to immunotherapies, and this is where we're working on, meaning can we use biomarkers to predict who will respond and for how long, or can we even modify this environment to make it more prone to a positive effect in the setting of relapsed multiple myeloma?